Hey, hello everyone, and welcome to yet another To Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the To Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel. You can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the To Talk, I have Dr. Gargi Roy Goswami. To give you a brief introduction about Dr. Gargi Roy, an interdisciplinary oral healthcare professional, is a dental genetics by profession and an academician by passion. Presently, with a pro team, she runs the dental home in West Bengal. Dr. Gargi Roy Goswami earned her undergraduate degree of dentistry from the Rajiv Gandhi University of Health Sciences, Bangalore, and pursued a certificate course in dental lasers. She has to her credit a postgraduate degree in applied genetics, MSc Applied Genetics from Bangalore University. She has more than 4 years experience in research associated with the JNU and with IIT Kharagpur. Her basic research interest caters to oral cancer genetics as well as saliva diagnostics. To make a mark and fulfill her dream, Dr. Goswami has come up with a startup, Dr. Kamlesh Roy Research and Diagnostic Private Limited, in memory of her father. This is the first company in the country which caters to research services and training pertaining to dental genetics. To place a mark in the scientific community, Dr. Goswami conducted the first international summit of Saliva Symposium India 2019 in Chennai. He has been honored with the Special Jury Award of Family Dental Entrepreneur of the Year 2017 and the Indian Dental Diva Young Achievers Award in 2018. Dr. Roy is the founder and director of Croinus Private Limited, Indian Academy for Clinician and Dental Genetics, founder and chairman Saliva Symposium India 2019, coordinator International Board of Saliva Diagnostic Science Denmark, adjunct faculty Research and Development, Savita Dental College and Hospital, Chennai, section editor of the Dental Section Journal of Biomedical and Therapeutic Sciences, former course coordinator and visiting faculty, Indian Dental Association, Head Office, Mumbai. Dr. Gargi, thank you so much for joining me today in today's Truth Talk conversation.
Thank you, Dr. Rekha. I think it was a huge introduction that you made. I mean, that was not necessary so much. And thank you for this opportunity because you are doing a wonderful job, I should say, because this kind of awareness programs are much needed where we should connect with our people, which is more important rather than we connect to ourselves as practitioners. So I think I congratulate on your endeavor, and I think this will go very long, and it's just a start of a very good journey. Thank you so much.
Thank you so much for all your support, Dr. Gargi. So, since you are a dentist and also you have done your post graduation in genetics, I was just hoping that you would throw some light on saliva. Saliva,
Yeah.
which is probably the most ignored, neglected part of the entire oral cavity. So, if you can
Yes.
just tell our viewers some significance or the importance of saliva.
Sure, I would love to do that. The thing is, saliva, as you know, is called as the body's mirror. So, why is it so? Because whatever molecules we find in blood, whether it is pathological or for physiological reasons, everything we can find in saliva. So that is why it is called body's mirror. And as a fluid, yes, it is neglected because, but I shouldn't say neglected because now much is happening from quite a long time. It is happening in the global perspective. I hopefully in our country it will happen. The thing will take up very soon, and because saliva is something without which it's just like you cannot survive without water. So it's similarly without saliva you can actually not do anything. I mean to say whether it is even like when we are speaking right now, or when you try to chew your food, and it's just like any functions. I mean it has versatile functions, and not only that, apart from the normal speaking and digestive functions, it has wonderful protective function, because saliva is one thing where saliva is basically, if I put it in a simple way, it is the first line of defense of the human body defense, because when we are born, the first immunity we get from mother's milk, and then slowly is the saliva, where we get all types of molecules, all defense soldiers who are there to protect us. Like we have antibacterial proteins, we have antifungal, whatever you can think on earth, you can find in saliva. And yes, as you said, it is not much studies and but studied, but particularly from, I should say, the study or the interest in saliva has is not new. In the global perspective, if you see, it's almost the publications that we find, it dates back to 1998 or even before that. So yes, if I talk about the commercial aspects, like bringing up diagnostic tests and all, yes, that's happening in the 2000s only. It started
So,
in that time.
So,
So
so,
yeah.
so in that sense, if you say saliva can be used as a diagnostic tool, so what do you think,
Absolutely.
Dr. Gargi, in today's scenario when we have this coronavirus that's happening everywhere, and since
Yeah.
we are also aware that the virus is present in saliva, do you think
Yeah.
saliva can be used as a quick diagnostic tool to detect the virus?
Yeah, definitely. And I think though the test is not available in India, but it's being already out in the market. So we have saliva diagnostic kits with which you can. It is a PCR based kit, meaning to say that you actually find the nucleic acid of that virus. I mean, the virus as such doesn't move around in your saliva, but it's the infecting particle of the saliva of the virus that you can detect. And there are certain technologies that for that you need the laboratory support, where the people in the laboratory can identify pinpointedly whether the viral load is present in your saliva or not. But before that, I would like to tell is, as you mentioned, coronavirus. Yes, now we are hearing many things about it. Some are rumors, some are good, some are bad. But I think I should focus on few things which will help people to understand why this awareness is being created. The first thing is that regarding coronavirus, it is a virus similar to the one which which causes common cold to us. Is the same family of viruses. But why it has taken up such a big scale? And before that, also I must tell that the dentists, particularly the dental professionals, are at the highest risk of getting exposed to this, because the way our work is and the way we work, it's a very close contact with the patients, and whatever procedures we do, it literally, everywhere is, we get aerosols, or patients will spit, and all those things are there. So we are very vulnerable in that way. Even for dental procedures, patients are also vulnerable. So I would like to point out some few things. I mean, not the usual awareness. I think that has much been done by the grace of social media and other stuff. So see, you might have heard nowadays that everybody tells, or we are being cautioned that please wash your hands with soap, or sanitizer, use sanitizer. The reason is the easiest way to kill the virus, because the virus, in this kind of family of viruses, there are different kinds of viruses. So the coronavirus, it falls in a category which are enveloped virus. So what happens when you use soaps or sanitizers in the alcohol? Sanitizers, we have alcohol; soaps, we have detergents. So all these alcohol or detergents help to degrade or destroy the outer covering or this envelope of the virus, and within few time the virus gets literally killed.
Dr. Gargi, so if we are trying to say that as carriers, means as
Hmm,
asymptomatic people, if
hmm.
there is a virus present in the saliva, do you think meticulous oral care, like use of mouthwashes or warm saline rinses and things like that, will that help in reducing any amount of virus that would be present in the mouth?
I literally don't think so, because when we talk about mouthwashes, or even if you are saying, like I have seen people are talking about, or I have in my family and friends also, who ask that can I take antibiotics so that I am protected from the virus. No, it is not actually that, because antibiotic will kill bacterial in any bacterial infection you have. For that it is antibiotic. But generally, like literally, if you start taking too much of antibiotic, particularly I'm talking about self medication, which is very dangerous, and that's something, because of online platforms and all, medications have become very much available to people. So without understanding, without physicians or your whoever you are seeing, whoever doctor, without their prescription, please don't just do self medication, because it will not help you anyway from getting away from the virus. But what you can do is to follow these simple instructions that is being propagated by WHO, that is World Health Organization. If you go to Google and search about WHO in and coronavirus, if you put these keywords, you will get you will get the official site of WHO, where each and every precautions, each and every thing about the virus and how you can prevent it is mentioned. And as you see that now it has become that offices are getting closed, or government is doing much in India and also in all the countries, that you should not go to social gatherings, public places where so much of gathering. The only reason is that and they tell you that okay, stay some meters or some feet away from person who is coughing. So the only reason is that the virus is very contagious. It spreads even, if I'm talking now and some person is just a hands palms distance or hands distance, half a hands distance from me, and then my spit, if I'm infected by any chance, my spit goes, and even if it falls on a surface, the person touches, in that way the virus gets transmitted. And one more important thing is that the life, which we call the incubation period, I mean, still what time the virus would stay. Actually, the pinpointed answer is not yet been found. It is being the entire scientific community in the whole world is behind it. And but now it has been found that at least 5 to 5.5 days the virus will remain as such. So you have
So for
covered
5 days.
yes. So
Oh,
that's
that's a
why
long
the
time.
best,
That's a long time.
yes, that's a long time. And so that's the best way that you can take preventive measures, protect yourself. And if you protect yourself, automatically you protect others. Because the main problem with this virus is there will be no symptoms until if the person is infected. He or she may not have symptoms entirely, or they may get some milder symptoms depending again on the age, because the incubation period inside the body, almost after 10-11 days only you can understand. Even if you are you are infected and you are go for a test, for any test for the virus, you will not be getting a positive result. That's the problem. Till the virus actually infects your body, it roams very nicely inside you. You will not catch hold of that virus. So you have to be very careful. So these are the small things that you can do. And the isolation, or not going to gatherings, why this is being told? Because right now, if you see, like when this is a kind of disease which is happening everywhere. So this kind of disease is called epidemic or pandemic, meaning to say that it affects various parts of the world once at a time, and whole lot of people gets affected, or the people die out of the disease. So we are right now in the stage 2. So there are stages we can divide a particular disease in epidemiological way. So in India is now in stage 2. So it's very necessary that if we become aware and we just follow these simple preventive measures. Only thing that we have to think is that we are not going to allow this virus to spread.
Right.
So then we don't go to the next stage. And if we
Yes.
don't go to the next stage, I think 90% of
Virus
the
is
work
fine.
is done.
Yes,
Yes.
yes. So that means to say, good personal hygiene, including good oral hygiene, would be the key to stop the spread of this virus. That is at a personal level, that each person and each individual
Absolutely.
take up the responsibility and say that I will prevent it, and I will prevent the spread of this infection within the society.
Absolutely, absolutely so. And for example, if it is see, we are doctors, we are healthcare professionals. We just cannot deny duty if a patient comes to us with a emergency. So you don't need to literally shut down everything and say. But if a patient is in literal emergency, please do treat them. And for patients also the same way. If you have a very much emergency, only then you go and visit. And in that case, please follow the instructions and the preventive measures. Like if for the doctors, I should say that you should always wear the normal thing that we do, the gloves, mask, everything. And I have heard people saying that if I wear 3 masks, then I will be more protected. Nothing like that. You can wear 1 mask, wear it very properly. That is
The
more
effective
important.
one, the one that's
Yes.
actually effective. Yes.
Yes, and wear it properly, and don't touch once you wear the mouth mask and then you start touching it, then it doesn't
Yeah.
make sense. So these are the small things that will really help
Go a
us
long way.
not,
Yes.
yes, in a long way, and not to take the disease in our country. At least we are fortunate in that way to the next level. And mostly this is with antibiotics, normal medicines that you know very well. I mean, I think nowadays common people know more than us. They will only tell us the doses. So no, I'm just kidding. But yeah, those medicines are not going to help you, because this is virus, and those are different kind of microorganisms. So till now, till date, the world is working. World scientific community is working. The National Institute of Health, that's the main hub of research of the entire world. So I think the first trial vaccine has been done very recently. I think some 2-3 days back for the coronavirus. But yes, to come as a marketable product, it will take little time. But till then, I think. You can just keep yourself safe
Take
and
effective.
keep others safe. That much only I can say. Yeah.
So, Dr. Gargi, thank you so much for sharing your experience with our viewers today. I hope that was helpful to all of them, and I hope I can get you back on this program for another
Absolutely.
interesting topic.
Anytime.
Thank
Anytime.
you.
Anytime. Thank
Thank
you.
you.
Thank you, Dr. Rekha. Bye bye.
That was Dr. Gargi Roy, who did talk to us about the significance of saliva, and also in the present COVID-19 epidemic scenario. I hope that talk was helpful. If you have any doubts or queries, please do leave your comments in the comment section below, and we will get back to you on that. And do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel and follow us on social media. So until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.